whole mission of EBMT is very close to my heart because I am a clinician and I have been working for the last 30 years or plus in stem cell transplantation in patients with hematological malignancies. So this is why I was engaged with EBMT so many years ago, and I have been working as much as possible to make EBMT even a better society. Times are changing, and I think that if we look into the future, one of the most important challenges that EBMT will have to have is the advent of new cellular therapies, so basically CAR T cells. If we look at our registry, at the EBMT registry, the number of patients being treated with CAR T has significantly been increasing over the last few years. CAR T cells are being used nowadays to treat patients with hematological malignancies, but probably in the future they are going to be used to treat other diseases, and probably the best example nowadays is systemic autoimmune disorders. Accessibility and affordability has always been an open question when we talk about stem cell transplantation, but the relevance of this question, I think it's more important when we think about CAR T and how CAR Ts are going to be positioned in the treatment of certain malignancies. Of course, there are many local and national regulations and issues that are associated to this concept of being affordable and being accessible. And I really think that these concepts are a little bit outside of the EBMT scope. But on the other side, I think that EBMT should be able to increase the awareness of the efficacy of these new cellular therapy strategies through high-level science, through educational activities, through advocacy activities, to make them being used as much as possible around the world. EBMT is fully committed to patients, and in fact, if we remember our mission, we are trying to improve the long-term outcome, and we are trying to save life of patients with hematological malignancies. And basically with this objective, and to try to bring patients' need more into the core mission of the society, EBMT developed several years ago the Patient Advocacy Committee. And the Patient Advocacy Committee had several objectives and several commitments. First of all, to bring patient-related issues to other EBMT committees and eventually to the working parties of the EBMT. Also, to try to provide enough information to EBMT to develop guidelines related to stem cell transplantation and other cellular therapy to the patients, to try to improve and to increase the awareness of international patients, family members, and patient advocacy group to attend the Patient and Family and Donor Day that happens for the last few years in the annual meeting of the EBMT, and also to try to establish connections between national patients group, patients advocacy groups, and also with EBMT. And the final objective was to try to bring as much as possible patient needs, patient requests into the EBMT daily activities. We have been working really very hard to try to fulfill and to accomplish these objectives. I'm sure that many of them are still pending. This is one of the objectives of EBMT for the next few years, and this is one of the aspects that was heavily discussed when developing the strategic plan of EBMT as a scientific society. In 2021, the EBMT board approved the development and the creation of the Equality, Diversity and Inclusion Committee that from then has been reporting annually to the board. So from my personal point of view, I'm really a strong believer that the only way that EBMT as a scientific society has to deliver 100% of its commitments to our community, our centers and members, and to the patients is if we follow the EDI policy. I am very proud to be the president of this society that is celebrating its 50th anniversary this year, starting with 3 members in 1974, reaching more than 5,000 members in 2024, and having achieved so many milestones over these years.